Imagine two patients. Let's call them patient A and patient B. Patient A arrives for her routine mammogram. She feels perfectly fine, but an AI system reviewing her scan flags a tiny, early-stage tumor. So small, no doctor noticed. Thanks to that early detection, she's treated promptly and her life is saved. Patient B arrives at A&E with shortness of breath. An AI model trained on thousands of past cases concludes his condition is anxiety. The doctor, trusting the AI, sends him home. Hours later, he dies of a heart attack, a diagnosis the AI missed because it hadn't seen enough cases like his. One life was saved by AI, and another life was lost to it. So as AI is rapidly becoming a trusted partner in medicine, a critical question arises. Can and should we trust it? To answer that, let's begin by exploring the rise of AI in medicine and how AI is already beneficially transforming healthcare from improving efficiency to advancing how we research, diagnose, treat, and even prevent illnesses. AI can take patient notes during a consultation visit or appointment. Think about how much time that saves a doctor. Time that can be redirected towards you, the patient. No more having to take patient notes after your visit, no more details being missed. This means better care and an increase in the number of patients that doctors can see daily. With the NHS being a system that's heavily overwhelmed and understaffed, this efficiency is crucial. Then, there's medical research. AI is accelerating drug discoveries and clinical trials through cutting years and millions off the processes. So instead of testing many potential treatments, AI can quickly process vast amounts of data. This aids scientists in determining which treatments are most likely to be effective. This saves a lot of time and helps focus efforts on the most promising treatments early on. AI can also make clinical trials more efficient. It can help select the right patients to take part, which will make the results more accurate. It can even track how patients are responding during a trial, spotting any issues immediately. Overall, this means that new treatments can be developed and made available to patients much faster and more safely. Like with patient A, AI can rapidly analyze medical images, and often even with more accuracy than the human eye. It can spot early signs or stages of diseases which are otherwise likely to go unnoticed. For instance, Google DeepMind developed an AI system which outperformed radiologists in detecting breast cancer on mammograms. It reduced both false positives and false negatives. So this is a clear demonstration of how, when trained correctly, AI can serve as a powerful and a valuable tool. And it doesn't stop at just images. AI can scan through your entire medical history. It can consider your genetics, your lifestyle, your previous treatment responses, and use all that information to anticipate future health risks. Imagine knowing the risk of a certain condition before symptoms even arise. This means less time in hospitals, reduced healthcare costs, and ultimately, more lives saved. So this also links the idea of personalized medicine. AI can analyze patient data, and often it can makes you steer away from generic treatments and create more personalized treatment plans. So this approach will lead to more effective treatments, improving outcomes for reducing the chance of side effects or ineffective treatments. So in short, AI is helping medicine become faster, more accurate, and more personalized. But with all these breakthroughs comes a reality we can't ignore. AI is not perfect. So let's explore the ethical questions that this raises. Questions that not just challenge how we use AI, but whether we're using it wisely and fairly. First, privacy. When AI systems are being trained on patient data, we must ask, who owns this data? How is it being stored, shared, protected? Because in healthcare, patient confidentiality is not just policy, but the foundation of trust. Second is accountability. Take the case of patient B, where a fatal mistake was made. Who was accountable? The doctor who trusted it? The developer who built the algorithm? The hospital that implemented it? As AI becomes more involved in life or death decisions, these questions become pressing moral dilemmas. Third is bias. If AI models are being trained on biased datasets that don't adequately represent entire demographic groups, inaccuracies in diagnosis and treatments could be made. We must be vigilant and ensure that the data that AI models are trained on reflects the full diversity of patients. Because a biased algorithm in healthcare is not just unjust, it's dangerous and potentially life-threatening. Now, these are all urgent and tangible challenges, but underlying all of them is a deeper, more fundamental issue. AI doesn't feel. It doesn't understand suffering, fear, or hope. It can't grasp tough medical decisions. And that's where human judgment comes in. Doctors bring empathy and care. They understand context, and with that bring moral reasoning. And that's something no machine, no matter how advanced or intelligent, can replicate. So what does ethical medicine look like in the age of AI? It's not about human judgment versus machine intelligence. It's about synergy, about bringing together the strengths of both. Doctors should not be replaced by AI, but empowered by it. The question should not be, will AI replace doctors? But how can AI help revolutionize different facets of medicine? Let's aim for a future where AI is used ethically and used as a tool, not as a solution. A tool used to revolutionize, not to replace. Thank you.